Hi there, my name is Katelyn Reed. I'm one of the therapists here at Thriving Minds, and I'm also the Selective Mutism Program Director. Understandably, a lot of people have a number of questions about the early stages of treatment. One of those questions is if you're a parent looking for therapy for your child or your teen, should they be coming to that first intake appointment? And so I wanted to offer a little bit of information about that topic. So firstly, the answer is going to vary significantly depending on your child's age and their kind of level of independence, and also potentially by their diagnosis. So if you have a young child, perhaps elementary school age or even some middle schoolers, we might recommend that your child not be present at the intake appointment. Certainly, we're going to speak in a fair amount of detail about your child's strengths, but also by default, we have to address some of the things that are your concerns. What specifically you're hoping to have us help you with, what goals we might have. And for young kids, it might be very uncomfortable for their parent and for their new therapist to be speaking about them in front of them and to have very little to contribute to that discussion. So by and large, with young kids, we would recommend that they not be present. On the other hand, if you have an older middle schooler or more mature middle schooler, or certainly a high schooler, your therapist might recommend the exact opposite. We don't want our older clients to feel as though they're being talked about. And certainly older kids, teens, have much more insight into what's going on for them, certainly in ways that perhaps you don't. And they might have even requested therapy and given you very limited information about what they're hoping to discuss with their therapist. So they are probably going to be an invaluable source of information for us to be able to craft goals for treatment. So that's kind of the other consideration. We wouldn't want them to be left out. And I mentioned earlier that the child's potential diagnosis may also impact things. So I mentioned at the top of this that I am the Selective Mutism Program Director. Selective mutism, if you don't know, is a condition where kids speak openly in some environments and feel frozen by anxiety in other environments. So the first time at a new clinic, meeting a new person is likely one of those environments that they would have a really hard time speaking. And even if they're an older adolescent or teen or even young adult, that might be pose a really significant challenge for them to be able to verbally communicate, in which case the parent and I would probably be doing a lot of speaking about them in front of them again, and that would just be exceptionally uncomfortable, I think, for everybody involved. So depending on the diagnosis, your therapist might kind of lean one way or the other. So I guess the summary is that that's a decision that you and the therapist are going to make together, and certainly our clinical team will help you to kind of make the best decision whether your child does attend that first intake appointment or whether they stay home and just kind of join when we're ready to meet them and we have a little bit more information about them and feel prepared for kind of what treatment will look like. Thanks so much.